Hello, fellow Rotarians. I'm Ambassador Sally Cowal from the American Cancer Society, where I head the Society's efforts on global cancer control. I say fellow Rotarians because I am one of you. I'm an honorary Rotarian from the Port of Spain, Trinidad, Rotary Club, where I was named to that position while serving as U.S. Ambassador to Trinidad and Tobago in the early 1990s. I also say fellow Rotarians because I grew up in a Rotary household in, of all places, Chicago, Illinois, the first Rotary Club in the world, where my father was a very proud member, and my mother a member of Rotary Anns, the auxiliary group that existed in the time before women were full members of Rotary. So as you can imagine, in my household, we devoted many Saturdays and Sundays to service projects with Rotary. And I know firsthand it's all about service above self. And I want to congratulate Rotarians for the wonderful work they do all around the world. As a public health person, I'm particularly mindful of the tremendous efforts that Rotary has made in the fight against polio. 30 years ago, over 300,000 new cases of polio came to our shores and our communities and our countries every single year. Now, thanks to the Rotary efforts, that total has been reduced to about 400. That's an incredible global success story for public health. Today, I want to talk to you about a new challenge, and one where I know that Rotary could also make a difference. And that's the challenge of cervical cancer. Over 250,000 women, more than 250,000 women, are dying every year from cervical cancer. And 87% of them live in low and middle income countries. In fact, they are by and large the poorest women from the poorest communities. And these are not women in their 60s or 70s. These are women in the prime of their lives, women of age 20 and 30 and 40, whose loss is a tremendous one for their families, their communities, and their societies. And yet this is happening when we have the tools at hand to address the cervical cancer burden and really to end cervical cancer and to make cervical cancer the first cancer that we can end on the globe. And I know Rotary can make a difference, and I know the Rotary Action Group on Health Education and Wellness can lead that charge. Let me tell you a little bit about the statistics and what we can do about them. We have an HPV vaccine available. HPV is a virus which causes cervical cancer. About 90% of all cervical cancers are caused by HPV. The vaccine is being made available through the Global Action on Vaccines Initiative, Gavi, at a very low price to lower income countries. So we could really, over a 10-year period of time, vaccinate every girl in the world. Secondly, we have effective screening devices that can be used in low-income settings. By just shining light on the cervix and putting a little bit of vinegar on it, we can see precancerous lesions and we can take care of them before they become serious. So we have prevention tools that are available. What we need is increased awareness and increased resources, and that's where we know that Rotary can play a part. There are many ways that Rotary can join with others to bring this preventable disease to an end. You can talk to your policymakers and government leaders. You can talk to girls about the importance of being vaccinated. You can get involved in screening programs which get to low-income women in countries all around the world. After all, it's a matter of equity and human rights. Where you live should not determine if you live. And together with Rotary, I know we can bring cervical cancer to a successful end. Thank you. Enjoy the rest of your conference, this working group meeting, and beautiful Seoul in the springtime.